This is a technique or a strategy that I've actually had published last year in the Journal of Clinical Orthodontics, and I want to share an abbreviated version of it. This is an actual case, and I'm using this technique right now. So here's a patient where we still have 7 and 10 slightly lingual, but you can notice the main cosmetic issue is the shortness of these teeth. Now, we're always programmed to look at the incisal edge and extrude short teeth, but the culprit here, the reason for this discrepancy, is the actual length of the clinical crown. The gingival margin looks fine. So trying to extrude these teeth would not be a good decision on my part, in my opinion, because with a high smile line, you'll see a gingival margin asymmetry, and it probably won't be stable, and it's not getting to the root cause. So I want you to notice that these 7 and 10 are slightly lingual, and also I want you to notice that even if you did want to add bonding on those teeth, we just still do not have good clearance. Maybe a little bit on this side, but not as much on this side. And so here's the technique. What I'm going to do is I'm going to put attachments on these teeth, and I'm going to use the attachment to grip the short clinical crown, and I'm going to begin by rotating these teeth or moving them buccal. This will allow space for the teeth to have bonding afterwards, as you can see right over here. But here's really the main point here. The dentist, or if you're a general dentist, you could do bonding now. But what I have done is I have programmed the ClinCheck to extrude these teeth. Now, I just told you that I'm not going to actually try to extrude the teeth. But what I now have, and this may be the best stage, any of these aligners that you think is the best fit, once you're done with the rotation, which ended by the 7th stage, then you can take the 13th aligner. Don't worry about the attachments. I don't know if you can actually have Invisalign take the attachments off at this stage, but basically now what we have is a perfect bonding template. And by the way, even with the attachments there, you can just take down the buccal aspect. But what we have now is an incisal edge morphology and sort of a customized crown former, and you can do it both at the same time. So you would take this tray, prep the teeth, which remember the tooth is going to be at this height, and then you prep the tooth, and then you fill the template with bonding material, put the template on, cure it, peel it off, and then you can shape from that point.